Now, the story of the discovery of the Omicron variant of Covid-19 has been moving rapidly, multiple developments taking place. One person who has been on top of the latest is Malan, editor of the Bhekisisa Centre for Health Journalism. She joins us now. Mia, always a pleasure being in conversation with you. So we're seeing multiple responses, right? On the one hand, there's been this crackdown in terms of the imposition of various trade bans. On the other, growing voices that say that this is not the way that countries in the world should be responding to this problem. Are we likely to see it result in perhaps some of these countries that have imposed travel restrictions and bans taking a step back and reviewing those decisions?
Well, there's certainly been very strong calls for them to change their decisions from our government. And the Health Department this morning also said that SADC countries will this afternoon or later today be releasing a very strongly worded statement calling on them to reverse their decisions. Sadly, there's also some African countries now, for instance, Mauritius, that have implemented travel bans against some southern African countries. But very strongly, it was also presented this morning at a Health Department press conference that there really is no scientific justification for these bans. And the reason they won't work, Professor Salim Abdul Karim said, is because we already know of many other countries where the virus is or the new variant is, and trying to cut off Southern Africa is not going to stop community spread in those countries. What would work much better is to only allow the vaccinated to travel and to do things like testing when you come into a country and to screen for symptoms before someone boards on the plane.
Mia, let's talk about that briefing then earlier on in the day by South African health officials and some scientists. It's very clear that a lot still yet to be discovered about this Omicron variant.
Yes, what we only at the moment can do, because we have no clear evidence, is we can have likely scenarios. So, for instance, when the scientists look at the mutations on the new variant, they know some of them because they also appear in other variants, and some of these are associated with increased transmission, so it makes it easier to get the virus, and some of them are associated with immune escape, so when it relates to antibodies. So the likely scenarios that they're thinking of is that it's possible that the Omicron variant could possibly be more transmissible, and that it could also possibly increase the chances of reinfection. So if you've had COVID, to get COVID again. But we don't yet have clear evidence on that. The Health Department said last week that from Wednesday this week and onwards, we may start to get some results. But for Pfizer and J&J, it will take about 3 to 4 weeks, according to scientists, to have a clear indication of whether it is indeed more transmissible and whether it can escape immunity.
In the wake of the criticism that has been leveled against South Africa, and in some instances our scientists around how the announcement of this variant was communicated, do you think that things are going to be handled differently next time? What is the sense that you're getting from government now?
So I think the thing that we're going to see very soon in South Africa to our effort to try and stop the spread of the variant is vaccine mandates. I think the Health Department and also the President yesterday was very clear that there's a committee now who will decide on vaccine mandates. So what that will mean, essentially, they're waiting for recommendations, but it's likely to say that there would be certain venues and certain activities that unvaccinated people won't be able to be part of. And in order to be part of it, you would need to present your digital vaccination certificate. And this morning they compared that to anti-smoking mandates. So we have rules or laws in the country that says you can't smoke in certain places. So if you wanted to smoke, you can't sit in a restaurant or at a workplace. You have to go elsewhere. And it would be similar rules for unvaccinated people. And the reason for that is because even though vaccines don't protect us 100% against getting infected, they still make us less likely to be infected. In other words, there will be fewer people to infect other people. And also because they protect us against falling seriously ill, vaccinated people are less likely to overwhelm the health system than unvaccinated people.
Mia, speaking about the health system, does it mean we're going back now to a point where the health department across the country will have to try and beef up their own operations, create additional capacity for what very much looks to be the beginning of what is likely to be a fourth wave?
We really just don't know that yet. I do know that there are preparations for in case there's a surge in cases. They're looking at oxygen supply, at the number of beds that they have. But we have to remember that we now, other than any other wave, we have a third of adults who've been fully vaccinated, which will help with reducing serious illness. So, and we don't have exact information on whether this new variant is indeed more transmissible. If it's more transmissible, then it's going to cause more cases, and then we may see more hospitalizations. But we do need further clear evidence before we would know that, although the health department said this morning that they have seen an increase in hospitalizations, specifically in the Tshwane district where the new variant first emerged, and it now seems to also to be expanding to other districts in Gauteng.
Bhekisisa Centre for Healthcare Journalism's Malan. Mia, thank you. Always a pleasure.